Patrick Mahomes just went down with a pretty bad looking knee injury. Now, I'm going to explain it, break it down a little bit, but this is bad news for the Chiefs, whose season was already coming to a pretty underwhelming ending. And this is going to be one of the better angles we have of the injury. So he's just kind of running away from that defender when he takes a step and forces his knee into knee hyperextension. This frame right here really shows the injury well. He's clearly in that hyperextended position. And it's really tough to say what causes these injuries or what predetermines who's at risk for this. I know Patrick Mahomes was previously dealing with a knee injury. I'm not exactly sure to what extent because I haven't really been tracking that. But speaking purely from a biomechanical standpoint, if you look at the way that he takes this next step, his ankle almost collapses in and then recoils outward, almost as that stretch reflex mechanism. And that's kind of interesting because I think that collapse of his arch changes the position of his knee, and that may have been a factor that caused the hyperextension. Again, I'm just speculating based off this video, trying to find some sort of biomechanical aspect of it. But it's very hard to predict any one factor that could have caused it. In reality, it's probably the culmination of a bunch of these factors that led into this injury. Now, for this injury, I would predict it's going to be some sort of PCL injury. That's not to say that it's not a multi-ligament injury with ACL and PCL, but I think with this mechanism, we tend to see the PCL injured here. We do get a shot of him walking on the sideline, and I don't think that's anything to predict how severe it is. You can walk if you have either your PCL or ACL torn. But I guess that kind of tells us it's not a full multi-ligament knee dislocation type of injury, but I wasn't suspecting that anyway from the video. From an anatomy standpoint, when we have something like a knee hyperextension, what's going to happen to everything is everything in the anterior or the front is going to be compressed, while all the structures in the posterior or back of your leg are going to be stretched out. So now thinking bigger picture here, like all of these structures in the back of your leg, you can think about the heads of your calf or your gastroc or the hamstring muscles that are all going to be stretched out when you have a injury like this. So thinking past just the ligaments, you also have to worry about these muscles that could be torn or damaged as well. Now on the anterior, the other side of your knee, right, the front, you think about the bone structure. So everything in the front is going to get compressed and crushed. So the end of that femur, the femoral condyles, and the end of your tibia, the tibial plateaus there, are going to come together and collide. So that's going to cause bone bruising, as well as impingements of certain structures like fat pads and other structures that are in the front of your knee there. But going back to those major ligaments in your knee, you can see here, this is your PCL. It's going to be right in the back when we're looking at this posterior view or from the back. And then your ACL is going to be tucked in there. It's a little bit more visible from the anterior or front of your knee. But the main role of your PCL or your posterior cruciate ligament is going to be to prevent the posterior or backwards translation or sliding of your tibia when your femur is fixed, and to prevent the anterior or forward sliding of your femur when the tibia is in a fixed position. But this is just my prediction of the injury, and I just wanted to break it down a little bit. With these knee hyperextensions, just about every posterior, or in this case, posterior lateral structure is going to be affected to some degree. So they'll end up MRIing him either today or tomorrow and figure out exactly what's going on. So if you have any ideas of what you think might have happened, feel free to leave them in the comments, or if you have any other ideas, I'd love to hear them.